Communication, narrated by Lisa Shiver. Communication is defined as the process of transmitting messages and interpreting the meaning. And this consists of 5 elements. You must have a sender, a message to send, a channel by which you're going to send that message, whether it be written or verbal. You must also have a receiver, and lastly, you must have feedback. Feedback will allow us or give us information about, did the receiver understand the message that was sent? Effective communication does not just happen. This is a skill that has to be acquired through practice, basically. There are different levels of communication. They're intrapersonal, and this can be defined as things you say in your head to encourage yourself or self-motivate. There's also interpersonal. This would be communication between a couple people or a small group. And then there's public communication or public speaking, where you'd be speaking in front of a large group. 2 forms of communication. I'm going to talk about verbal and nonverbal, and we'll start with the verbal. This has to do with the vocabulary you choose to express yourself. What words do you choose? What meaning are you trying to say? What's the underlying meaning behind your communication? Also, how are you pacing what you're what you're trying to say? Is it rushed, or are you talking slow in a manner to where everyone will understand? Also, we have to consider the intonation. What's the tone of your communication? Do you sound angry? Clarity, is it clear? Is it brief? What's the timing and what's the relevance? As a nurse, our timing has to be wonderful when communicating or having effective communication with patients. A good example of this is if a patient is just diagnosed with a major illness. For example, maybe a patient's diagnosed with cancer. You wouldn't immediately meaning 5 minutes after, go in and start doing teaching about treatment and things of that nature. The patient needs some time to go through the grieving process, basically. So our timing is critical when we're communicating with our patients. The nonverbal forms of communication, they add cues and meaning to our verbal communication, and nonverbal is even more important than our verbal message we're trying to portray. This includes our personal appearance. What's our posture look like, or our gait? What's our facial expression? Are we making eye contact? Any gestures? What about our territory or space? If I stand here with my hands on my hip like I'm mad, but I tell you, no, everything's okay, well, then my nonverbal does not match my verbal communication. So nonverbal speaks volumes. I've got a Shiver hint for you. Communication is 90% nonverbal and 10% verbal, and that is so true. I'm going to talk about therapeutic and non-therapeutic communication and give you some examples of each. Therapeutic is what we want. This is beneficial in developing that nurse-client relationship. And we can use things like active listening. Get down on the patient's eye level. Pull up a chair next to their bed instead of towering over top of them. Show empathy. Use humor, touch, lean toward the speaker. Have a relaxed, attentive attitude. Use eye contact. Match facial expression to your feelings. And you also can use clarification. And by doing that, you can summarize what the patient has said, but that's also shown that you've been actively listening. With non-therapeutic communication, this is not beneficial or helpful to anybody involved. And some examples of non-therapeutic communication would be using personal questions or giving personal opinions. Remember, as nurses, we're not supposed to give our personal opinion. Changing the subject. Maybe the patient's talking about one topic and we totally change the subject. Or asking why questions. Why did you do that? We don't want to interrogate our patients. Don't be afraid that you'll say the wrong thing. Just be honest, be respectful, and show genuine concern and the desire to work with the individual. You will be non-therapeutic at times, but we can recover from that and we can learn. Therapeutic Communication does not happen. You have to work at it. But again, it's something you practice and you get better at with time. Next, I want to talk about the different relationship phases that occur between the patient and the nurse. First, we have the pre-interaction phase. Secondly, the orientation phase. Third is a working phase. And then lastly, the termination phase. We'll start with the pre-interaction phase. This is before you actually go in to meet the patient. Usually you know a little bit about the patient and we can review the data available. What's the diagnosis? We may know about their age, that kind of thing. Also, we want to make sure the patient's in an appropriate room, but usually that's done for us. We can go ahead and start anticipating the patient's concerns or needs based on diagnosis and their age and things along that nature. During the orientation phase, this is when we, the nurse, actually go in and introduce ourselves and set that positive tone with our patient. We want to be empathetic, make sure we assess that client and the health status, and then prioritize their needs based on what you find. We also want to clarify the client's role and your role, clarify the expectations, and let the client know when to expect the relationship to end. During the working phase, this is where you actually help the client express feelings. You encourage and help the client set goals, take action to meet those goals, and this is actually my favorite phase because you really are getting to know the patient at this point. Then there's the termination phase, and this is where we remind the client that termination is getting near. We evaluate our goal achievement and then help to achieve a smooth transition to other caregivers. So it's like at the end of the shift when we say bye to our patients. Other good techniques of therapeutic communication include professionalism. We always want to be professional, show courtesy, be confident, and be available. If we tell the patient that we're going to be back in 15 minutes, well, we need to do the best that we can to be back in 15 minutes. We need to establish trust, empathy, show sympathy, acceptance, regardless of the similarities or differences that we may have with our patient. Show respect. Silence, therapeutic silence. When in doubt, use silence. It gives you and the patient both time to reflect on what's been going on, and that's okay. Use hope, encouragement, socializing, and also use gender and cultural sensitivity. Barriers to effective communication can include inattentive listening, using medical vocabulary that's way over the patient's head, and that happens oh so too often, especially with the physicians when they come in to speak to the patient. They'll use all these big medical terms and then the patient's absolutely lost when the doctor leaves. So break it down on their terms so they can understand. We need to avoid giving personal opinions or being defensive. We need to avoid showing disapproval. Also, we need to adapt to cultural differences that may exist or overcome language barriers or sensory impairments that may exist as well. Now I want to talk a little bit about professional communication, and this has to do with our coworkers. Documentation equals anything written or printed within a client record. Keep in mind that a client record is a permanent legal written document. Why do we have to document? Well, this provides a written record of the care provided, and it also reflects quality of care, and it makes each team member accountable for what has been done. If it wasn't charted, it was not done. I often tell students that when you're charting, you need to chart like you are recreating that environment. So if we pulled this chart 5 years from now, we could say, yes, this is exactly what happened, and totally recreate what happened in that patient environment. With shift reporting, there are many different types of shift report these days. Sometimes the shift report is done in a group setting where all nurses hear the shift report, and then sometimes it's on an individual basis. Some facilities are going to the patient room where 2 nurses go interact and include the patient in shift reporting. The purpose is, though, to communicate what's been going on with the patient, any changes, what are the priorities, and also talk about what the plan is. Information that can be omitted from the shift report would include things like their age or things that haven't necessarily changed. You want to just focus on this admission and what has changed over the past 8 to 24 hours. With a transfer report, if you're transferring to another floor, another facility, you will need to give name, age, primary physician, medical diagnosis, and also a summary of the medical progress up to the time of transfer. Also need to note the current health status, current nursing diagnoses or problems, and any critical assessments or interventions that have been performed. And also they'll need to know about any special equipment. With telephone and verbal orders, we need complete info given to the physician. And you may have heard of an SBAR. If you have not, look up SBAR. This is a good tool to use that reviews what you need to collect prior to calling the physician. With verbal or telephone orders, this can be given to an RN by an MD or a licensed personnel by an MD, and the RN needs to write down that order as telephone order or verbal order. Then you'll repeat the order back to the physician to verify. So in the chart you may often see it written VORV, and this means verbal order reviewed and verified. It'll repeated and verified back to the physician. With professional communication, this means with other nurses and our physicians or any healthcare worker, we need to use courtesy, use names, privacy, confidentiality, be trustworthy, use autonomy, responsibility, and assertiveness. Speaking of confidentiality, information should only be disclosed to those who have a right to know or a need to know. And this all goes back to the HIPAA, which was established in 2003. In the Nursing Code of Ethics, it is the duty of the nurse to protect patient information. So that is part of the Code of Ethics. HIPAA, or the Health Information Portability and Accountability Act, actually states that the security and privacy of all healthcare data should be maintained. How does that affect you as the student? You will not put any patient identifiers in your paperwork, which includes initials, room numbers, or name. But as a nurse, you do not disclose any information to anyone unless they are directly involved in the care of your patients.